name is Janet Freeberger, and I'm the director. For those of you who may be joining late, I'm the director of Learn's Innovation Hub. Our final panel for today will be addressing the topics of future research directions and challenges. The purpose of this panel is to wrap up things we covered over the 2 days of the forum by thinking about next steps and where to go from here. The format of this panel is to begin by having each panelist comment on predetermined topics and or questions, and we will then follow this by a Q&A period where the audience can post questions in the Q&A feature of Zoom. So I'd like to begin with a brief introduction of each of our panelists, and then I will give them an opportunity to talk about their roles a little bit more. So if our panelists could turn on their cameras. So I'd like to begin with Kevin Christensen, who is the Rehabilitation Internal Process Control Coordinator for Technology and Telehealth at Intermountain Health in Salt Lake City, Utah. In that role, he supports over 1,400 therapists and leaders across 27 hospitals and 50 clinics in all rehabilitation disciplines and settings. Welcome, Kevin. My next panelist is Francois Fried, who is a cybersecurity analyst at Crowler Maritime, which is a logistics, marine, and energy solution company in Jacksonville, Florida. You might be wondering why he's here. Mr. Fried is also involved with the Brooks Rehabilitation Clinical Research Center as a member of the SHARP, which stands for Spinal Cord Injury, Community Health, and Research Partnership Group. Francois' involvement with Brooks began when he sustained a spinal cord injury resulting in paraplegia at the T7, T8 level in 2016 and received neurorehabilitation at Brooks. Welcome, Francois. And then finally, Hallie Zalesnik is the Director of Strategic Initiatives and Professional Development for UPMC Rehabilitation Institute in Pittsburgh, Pennsylvania. Her professional roles involve clinical practice, clinician mentoring, program development, knowledge translation, and quality improvement. She serves as a faculty member for the UPMC Rehabilitation Institute's neurologic and geriatric residency programs and is an adjunct professor in the University of Pittsburgh Department of Physical Therapy. Welcome, Hallie. So I'd like to begin by just giving each panelist a chance to introduce themselves to the audience by providing a brief summary of their experience with using health and healthcare data to inform practice and improve outcomes, and by commenting on one or both of the questions that we see on this slide. Basically, what specific challenges have you experienced or observed, or what do you think are the most pressing issues to address to make this process more effective? So I'll just start alphabetically. So Kevin, if you want to take the stage first.
Awesome. Hey, thank you. I really appreciate the opportunity to speak with you today. And as you mentioned, kind of before I get into the question, explaining my role a little bit more. So occupational therapist by training, but I get to work on the internal process control team. But my position is fairly new to Intermountain. I've been with them for about 3.5 years. And I think it speaks to where we are now with where it comes with technology. I mean, technology has been around and evolving for quite a while. But the fact that Intermountain has now hired a full-time employee to focus on technology initiatives, I think signals where we're at and where it's coming. And so I'll have a kind of a viewpoint that focuses very much on technology as I talk about these things. So to address that first, what challenges I've experienced or observed, 3 things come to mind. And using one example was over the past 1.5 years, we've looked at how we can improve doing a chart audit process. So we've had audits in rehab many times throughout the years. And the pattern that we tend to get was in previous years, we would go through an audit process, we would make certain changes, but those changes didn't last. And so this time we wanted to make sure that we really carried over that data and how we can actually make lasting change and inform. And looking at that, three things stood out, and that was standardizing. And with internal process control team, we're really always trying to standardize and make things get better. But again, three challenges or main things that come to mind is how do we standardize how and what data we're collecting across the system, and then being able to next, once you've standardized, discern what are the metrics or the parts of that process that are actually going to make an impact and that you need to keep your eyes on, and then effectively getting that message out. How are you communicating with and getting that feedback loop? None of that should be very shocking to any of you, but looking at what technology we have, again, I think that those challenges have become easier to solve. And in Intermountain and Rehab, we use tools like Microsoft Forms, Excel spreadsheets, and using those, I could share there's wonderful data collection and analysis and feedback loop and sharing with our frontline staff that's being taken place that no longer do I as a leader have to do. I can allow managers to set a standard and to collect data. In fact, in our acute care setting, we had a manager that wanted to start doing a daily data collection and was able to initiate a process where he now collects data from all of his clinics and he analyzes all of that. And that's just using a simple tool. So I think that we're going to continue to see technology that will make it easier to be able to do and address those things. Anyways, I think I'll leave it at that and let the next one.
Great. Great. Thanks, Kevin. That was great. Okay, Francois, do you want to go next?
Yeah, sure. Hi, everyone. So my experience with using healthcare and healthcare data comes from kind of different angles. One from the patient perspective. So in 2016, that's when I sustained a spinal cord injury. So since that, I've played that, the other side of the care, which is the receiving care. And so data's played a big role for me, obviously, because I want to make sure the clinicians that are taking care of me are educated and knowledgeable and are aware of what I need, and getting as much data around me is going to benefit me. So that's like the one side. The other side is after I got injured, I became a peer mentor to help, newly injured patients kind of get back on their feet and be more familiar with what they need to be. And that side was kind of gathering for myself data around them so I could provide them the best care that I could to help them, whatever their goal were. And then the other side is on the more recent side, I became a lived experience consultant for research. So on that side, we obviously have to look at the data that we're going to analyze and then look at, as a patient perspective, does it make sense? Does it make sense for that research, to cater to the patient's needs? Is there a need for it? What can we do to make it better? And then are the patient cares involved in that process? But so those are my overall experiences with this. As far as the specific challenges that I've experienced or observed, I think the biggest one would be the lack of access for patients to their data. After there's other things that come at play with that, but that would be the first place where, if you don't have access to data, how can you even learn more about it? The literacy is going to be an issue as well. So once you have access to the data, you want to make sure the patient's able to read it. But if they don't even have access to it in the first place, then, the reading literacy side of it's not going to really be at play yet. And then the biggest thing as well, if they do have access to the data and maybe they're able to understand it or not, is making sure they're not overloaded. So depending on the state of your injury or wherever you're at in your recovery, if you're given a lot of data, that can be very overwhelming. You either just because it's too much or because you're not at a state where you can fully process all of that data. So understanding as well, where the patient is at in their journey and how to provide that data, make sure they have access, make sure they understand it, and make sure they're not getting too much based on where they're at currently. So those are like the specific challenges that I personally have experienced or observed. As far as like the most pressing issues to address to make this process more effective, I think the biggest thing would be obviously to improve the data access. Not all facilities particularly have like, you know, the ability to give a patient access. Either it's, you get a report after your visit, print it out or whatnot. But like if you do things, for example, with like MyChart with Epic, making it easier for the patient to just access some of that data, like that already is a big step forward. And then obviously it would be just make sure it's user friendly. So patients might not be as familiar with that, so they need to be able to navigate that like with ease. So that's probably like where I'll leave it at for this.
Great, great. Thank you, Francois. And then Hallie?
Sure. My name's Hallie Zalesnik, and I am from UPMC in Pittsburgh, Pennsylvania. And my experience in using health and healthcare data to inform outcomes has come from implementing standardized outcome measures across our inpatient settings, and then standardizing the collection of our outcome measures and patient-reported outcome measures across our outpatient settings. From there, I assisted in building a dashboard to collate our data and then look at it and trying to determine the patients that are having meaningful change and those that are not. Some of the challenges that I've experienced, I think, have been around trying to streamline the outcome measures collection. There are a lot of really great measures out there. There are a lot of clinical practice guidelines that have a variety of different measurement recommendations. Trying to get large organizations to kind of agree and get on the same page with choosing the best one is a little bit of a challenge personally, but something that we're continuing to move past. But now what we're starting to experience is, okay, so we have all this really great data showing us what our patient outcomes are, and we know that there are clinical practice guidelines and best practices to help to, that can guide better outcomes, but how do we actually know whether or not our clinicians are following best care? So we don't have a really great way from a data perspective to analyze the treatments that are being provided. And I know, talking with a lot of people I saw as attendees, we've talked about this a lot in the past. I don't know that any of us has necessarily solved that problem, but I think a lot of us are doing deep dives and doing chart audits. I know, Kevin, you talked about doing audits, having clinicians audit one another. I heard someone say earlier. And so I feel like there's a pressing issue that we have to have a better way to describe our treatments in a more consistent fashion and be able to evaluate whether or not those best pathways are being followed.
Great, great. Thanks, Hallie. Okay, so we're going to move on now to the next question, which is, what successes and challenges have you experienced or observed in developing the infrastructure to facilitate learning health systems research? And I know you guys have hit on this a little bit with your introductions, but and then maybe I'm just going to try to facilitate this. I'm going to probably just call on folks and then try to make it equal so everyone has a chance to speak. Kevin, do you want to start and comment on that?
Yeah, when I consider this question, some of the things that pop out to me are the tools that we have accessible to us. So, I think a lot of people can relate, but things, especially when it comes to technology and the EMR and the data collection, a lot of times if you're not living and you're in that world, you're like, well, why can't we just do this simple thing, right? Why can't we track this data point? It seems so simple, but it inevitably just isn't. And so utilizing some of these more accessible tools, I see some hand claps, but yeah. So again, Microsoft Forms, but there's also Google Forms, there's REDCap, and you leveraging these tools that, in recent past may have seemed a little high tech or less accessible, but are a lot more common. Most people now know what a Google form is or a, Microsoft form. They know what a QR code is. So we can put that in the clinic and be asking our care providers or our patients to click on that, scan it, and give us some sort of data. Now, that's maybe not as clean as having something that's fully integrated in our EMR that does it automatically, Yeah, but we will eventually get there, and a lot of times using some of these simpler tools. So we're running a pilot where we're trying to get our OT standardized on some ROMS measures, and so we've leveraged these simple tools to get care providers to at least standardize and send some data back. So those are where we've seen the biggest success, is just use the tools that you have. I'm really encouraged in the future with things like ChatGPT and some of the AI analysis that'll just make things easier for care providers to get into that realm.
Great, thank you. Thank you, Kevin. Francois, do you want to comment next?
Yeah. So for the successes and challenges, one of the success I personally believe with Brooks Rehabilitation, we, as it was brought up, the Sharp Group, which we started about a year ago, focuses on like building a partnership between the patients and the clinicians. So to have the patients involved in that process of like building research out and make sure it's ready to go when it hits the patients and we start collecting data. So that's already like been a big success because we're already, starting to communicate more. For a personal experience, like when they start a new research, I come and see the clinicians and then we start discussing, like what can be improved, what can be done to make this better. And even just things simple, like what can just make it more comfortable for the patient, depending on like the research you're doing. Some of those patients might have to sit at hours at a time, still. And for some of us, we're already always sitting. So like we have to like, make sure like, are they our comfort? And so there's things that like sometimes are overlooked. So I think like that is already like a big success in itself, like to be able to build that partnership and make sure like there's more communication between the patients and clinicians. After the challenges that can kind of come with this is obviously finding the patients that are potentially a right fit to help with that program. You have to either find patients that are either already educated or spend the time to educate the patient to get them up to speed, to be able to provide at least valuable insights, and as well, obviously like putting the program together can be, if you don't have the support from your hospital, or for us like Brooks Rehab has been great about supporting us, but for some other places it might be considered, if it can be proven to be valuable, that's an aspect that needs to be addressed and can be a challenge.
Great, thanks, Francois. And then Hallie, do you have anything to add? And
no,
then
I think they gave a really great overview.
Okay, so then I'm gonna have you answer the next question. So if you want to go on to that one, thanks, Kristen. So, what strategies have been the most successful for you or your organization in applying data or evidence to improve practice and patient outcomes?
Yeah, that's a great question. I imagine based on the size of the organization as well as how the people are organized within that organization, it's probably going to be very site specific. For us, it's been having support on both sides of the coin. So having leadership support, so having our executive teams be interested in improving patient outcomes, looking for innovative strategies, looking to implement evidence, and then also engaging the clinicians in determining how that could best be done within their different clinical settings. So for us, it's been the ability to engage, basically everybody within the organization and kind of having a stake in the game and a say in how that's going to be done.
Great, thank you. Kevin, you want to comment?
Yeah, going along with the theme that I'm talking about with is, as we've used some of these simpler tools, you're collecting a lot of data. And like I've talked about, standardizing some of these tools can be really great to standardize. Going back to what I shared before, doing chart audits, it used to be pen and paper out in the wild, and we would update that process, but would it ever get out to the people that still had the paper copy? So as we've standardized using some of these simple tools, that's really helped. But then also, as we collect the data, being able to give guidance on here's the things that really matter, because you can collect a lot of data, but I think all of us know being able to analyze and look and say what's really what we want to focus on all the stuff that we're collecting, and getting buy-in from the care providers and the managers who actually have to then turn around and share that and say, this is why we're collecting this. This is important. I think many of these tools, when we've seen success, have been tools that don't exclude the managers from that process or the frontline caregivers, so that they can come back and say, hey, why are you asking this way? Or why are we using this process and collecting this data? And we can be transparent. And then also package that in the communication of, well, yeah, we're doing audits, but this is why we're looking, and this is really the metric that we're looking at, so that we can share back to you and improve your process. So again, that standardization, but getting buy-in using some of these really simple tools.
Okay, great. Thank you. I think I'm going to go to the next question for Francois. Kristen, can you advance it just so we can get through all of our questions? And you hit on this a little bit, Francois. How can healthcare institutions improve patient data literacy to enable patients to meaningfully participate in data-driven decisions? So do you have anything more to add on that? I know you kind of hit upon it a little bit.
Yeah, so for this, it's a little trickier depending on, or are we, I was reading the wrong question. Or improve data literacy to enable patients. Yeah, so obviously with that, we want to make sure it's hard to simplify that process and do it right. But obviously when you're want to improve data literacy with patients, you have to first understand where they're at, the patient. So a lot of us, when we're newly injured, it's a whole new world, which is a big, I guess, milestone that we have to go through to really figure out, all of those new terms or everything. Because especially when you're coming from patients, they might not always think to talk to us in a more simple way. So the best way is, I think, figuring out who's the patient, how much do they know, who pretty much know who you're talking to, and then provide education for them. Either your organization can build education programs around that. The clinician themselves can, make sure to spend time with educating them, make sure the data is understood. But I think that'd probably be the biggest things I would point out. And yeah, that's just if they're educated and you make sure they're understanding it, they'll be able to partake in it more.
Okay, great. Thanks, Francois. Hallie, can you comment?
Yeah, I think you brought up some really great points. The other thing I would say is I think the providers have to take some responsibility, and we probably need to change the culture that we practice in. So I think it needs to become the norm that we discuss all of our findings with our patients. I think, I go back to an old clinical instructor credentialing course I took years ago, where they taught you how to teach students in the clinic, where they teach you that as a clinician, your mind goes from A to F without even thinking about it, because you've developed these really great clinical decision-making models. But to properly teach a student, you have to verbalize B, C, D, and E to the student. And I think the same model we have to start applying to our patients. We have all these great clinical decision-making pathways in our brain that are ingrained as providers, but we have to start talking to our patients about the data that we're collecting, what it means. How does it impact what we think about their treatment plan? How does it impact what we think that might be best for them today, or what we're thinking things might look like long-term? And also be transparent that we have all this data, but sometimes it still does not give us the answer of what's going to happen 6 months from now. So I think as providers, we can do a much better job at just having conversations with patients on the regular about our data findings and how we use those findings, and then share that information with them as the plan of care goes on.
Great. Thanks, Hallie. Okay, let's move to the next question. And this is another kind of patient-oriented question. So Francois, you're up. And how can patients be involved in transforming data to knowledge to practice?
I think the first one is empowering the patient. You have to, I've seen this a lot of times where patients don't feel like it's their place to be part of this, because either lack of knowledge or lack of confidence in that. So I think empowering the patient in itself, saying, your voice matters, and it's just like whatever you have to bring to the table is going to be relevant and it's going to be helpful. Even, if it's just something small, like it still makes a difference. So I think that's like the first step. And then after is as you're designing, those processes, like you want to make sure the patient's involved in that. So like if you're going to design like data visualizations tools or things like that, you want to make sure like the patient's there and you're really building a partnership with them. So it all comes down to having partnerships, more partnerships with them, because if we're active within any process that you build around data, we're going to be able to make sure that the data you're collecting is going to be geared towards what's going to benefit us, and then what's going to benefit the clinician as well. So those probably like my notes on that.
Yeah, great. Thank you. Thanks. That's great. Okay, let's go on to the next question, Kristen. And Kevin, you can start with this. From your perspective, what type of clinical decision support tools do you believe would have the most impact in improving rehabilitation care and outcomes?
Oh, yeah, I can't pick just one because there's so many that are out there, and even here in Intermountain Health that we're considering, and it's so hard to know which ones are going to be the most impactful. But one that we've kind of gone down the rabbit hole with is having a digital health platform. So I think in the last two questions that even applies to, of having a solid digital health platform that can connect your patients from home, in the clinic, in a digital realm, which has really become a standard of care. I mean, telehealth is become quite ubiquitous and an expectation, but a next layer, including with just telehealth, is also that digital health platform of how can a patient be providing feedback to the care provider that actually impacts care, but is not overwhelming that care provider. Because really the expectation and the need moving forward is that we're leveraging technology that will allow our care providers to make better decisions, but be able to do more with less. That's just the future that we have to evolve in, and there's a lot of reasons for that. But I think digital health tools can really do that and not lose out on that feeling of I, as the care provider, am making the decisions and guiding this process. And the patient still feels like I'm getting the care that I need. I'm connected with my care provider, but doing it in a way that actually offloads some of the work and the effort from both. So I think first and foremost that having a good digital health platform, but then shifting in on how can we improve documentation. There are things out there like DAX from Nuance, which kind of falls into the AI voice recognition realm, that will listen to the interactions between a care provider and a patient and actually write up a treatment note. And then the care provider can go back, review, and sign, make changes. That's actually already out there. Rehab at Intermountain doesn't have it yet, but our physicians in some clinics do. So I think some of those technologies can be leveraged in there. And there was one other one, but ChatGPT, that's a buzzword. But I think that there are tools that are going to shift how we interact with patients. But those are two that come to mind. Oh, and then the third one, real time, as a clinician is filling out documentation, providing feedback of, hey, maybe you need to consider following this protocol. It looks like you're deviating from that. Is that your intention? Allowing them to do that, but also guiding them to, if you're deviating for not a good reason, let's get you back on to the standard of care protocol. That's a lot.
Right. Can you clarify what you mean by digital health platform? Maybe give an example.
Yeah, so platforms like platforms that come to mind, MedBridge, Force Therapeutics. So
Okay.
you can build those internally, and even at Intermountain, as large as we are, we have a digital health app called oh god, what are they? I use it so infrequently, but My Health Plus. But that's not going to work for rehab. So we need to partner with a platform that already has it. Now there are platforms and digital health vendors that will say, hey, refer your patients and we'll just take care of them. It's like outsourcing your care. We've shied away from that. For some clinics and systems, that may be the preferred option. Ours is, can you provide a platform to connect, collect data, engage with our patients how we see fit, which we want to be the care providers, but we want to offload some of that work of collecting data, doing things like RTM. We're just having them be the platform that allows us to do that digital connection outside of, or even in the clinic. Hopefully that clarifies that.
Okay. Yep. Yeah. All right. And then Hallie.
Sure. I think Kevin really highlighted some three big hitters on that. And I would just expand on the last thing that you talked about, was having some built-in clinical algorithms into the EMR. And wouldn't it be nice, if you had some built-in reminders that evaluated what the information you were putting in on an evaluation that said, hey, this patient seems to be following in X category, that they may benefit from this style of treatment. I think we all like to think that we're the perfect providers with knowledge in every single expert area, but the reality is we're not, and we can all use reminders, particularly in cases that we don't see a lot of, or that we have less experience with, or with some of our younger therapists that are really just getting their feet wet with clinical decision making. So I think having those built-in reminders for what best practice is, and as you're putting things into an EMR, it's saying, hey, it looks like, this might be a good patient for, mobilization pathway or whatever, would be helpful.
Great. Thank you. And Francois, do you have anything to add?
No, I think they covered it. I mean, the only thing maybe is like sometimes remote monitoring tools could be good. So, I mean, we could go like something super simple, and maybe that's, an Apple Watch. Like if the patient's tracking some of data with that, and then be able to utilize that data. I mean, it can be even, because it can even show you commitment of the patient, depending on some things. So it can be useful, but that's the only thing I really have to add.
Okay, great. Great. Thank you. All right. Well, those are kind of the questions that we pose or planned ahead of time. We're at the point now where we can take some questions from the audience. We have roughly 10 minutes to ask the panelists questions. So please put questions in the Q&A if you have them. And we do have one question, so I'll start with that. To all the panelists, how often do you recommend to clinicians that they repeat patient-reported outcomes? Hallie, you want to take that first? You're smiling.
Oh, sure. But I've learned from the folks that are also on this panel and also attendees in this call. What we found as we kind of went down this path is that we had a minimum requirement of collecting patient-reported outcomes every 2 weeks to essentially meet compliance standards, to be able to say that we're assessing progress over time throughout the plan of care. What we found when we started pulling all the data into the dashboard was that our adherence to getting a patient-reported outcome at the start of care was very high, averaging 90% across 70 clinics, 300 clinicians. And, that's because the patient would walk in, check in, they'd do their pro, and then they'd go back. What we found, though, is that later on, when we go to look at who had an end of care outcome measure, it was very low, somewhere around 35 to 40% across our entire company. And so in working with some of the folks that are on the call as attendees and panelists, a lot of people recommended that the best way to ensure that you're going to get that end of care outcome is really to use the patient-reported outcomes more often. So every visit, perhaps considering every week. 2 weeks was not working for us. We did some pilots where we looked at some clinics doing the patient-reported outcomes once a week. We looked at other clinics doing them every visit. No surprise, the clinics that collected them every visit were the clinics that had the higher rates of return at the end of care. And then, after that, it's kind of starting to change culture, because you get into the weeds of, well, the patients are complaining, they're going to get survey fatigue, and you're trying to, really talk to the clinicians. It's not about the number of times that they're answering the questions that typically frustrates them. It comes back to having that conversation with the patient, telling them why you want that information, telling them how that information is impacting their care. not just to say, oh, well, I got one at the beginning and now I'm getting one at the end. And I had to get one every time in between just so I got my end one, because that's not truly the reason. The true reason is if I'm looking at and using those patient-reported outcome measures, I'm a vestibular PT. So when I'm looking at the DHI score, when my patient comes in, I can say to them, hey, when you came here, you said your dizziness was severely impacting your life. Your score was a 70 out of 100. I can say it's 50. I know you're not feeling great. I know we have work to do, but this downward trend tells me that we're making a difference. What we're doing is making a change, and you are starting to feel better. It tells me that we're doing the right thing. So for us, that's been helpful.
Great. Thanks, Hallie. Kevin, Kevin, I know Intermountain does have a history of collecting with the ROM system, at least, right? Outcomes measures pretty regularly. But so can you comment on your health system and
Yeah, so I believe that every visit that process is prompted for the patient to complete. And I think, Hallie, you put it very well, just for that reason, or well, for many reasons, but one being that you can show that progress and communicate that. However, I do sympathize in what we've been talking about, how we've struggled to get our care providers to take the time and to actually have a process that shares that progress or lack of progress, because I think both are important for a patient to understand. We've looked at how do we get that into it's just difficult, right? It's one of those, this should be so easy. You just take this data and get it there, but I think it's important. We have not figured out that part, but it's a good call out from Hallie and others of we need to collect it so we can share it, but there is that breakdown of getting that feedback to the patient.
So Francois, do you want to comment from experience or thoughts on the burden, from a patient's perspective, if you were asked to fill out this same darn form every time you come in?
Yeah, no, I mean, that's a good point. I do agree every visit is probably better, but you have to educate the patient on why, because if we don't understand why, we're gonna feel like you're just putting a chore on us, and it's just gonna be the extra burden of like, why do I need to do this? Why does it make sense for me? So, but I definitely agree, because if you have those done, every visit, you can course correct if it's not going in the right direction for the patient or for the clinicians. For both parties, we need to address things as quickly as possible, so we're not wasting primarily the patient's time, because they're here for care, and that care needs to be obviously the highest possible.
Great, thank you. Okay, we do have another question in the chat. This is specific to you, Hallie. What barriers have you had to incorporating clinical decision tools into your EMR, or if you've even started that?
Yeah, I started to type the question and I was too excited about listening to Kevin and Francois too, so I had to stop. We have not started it. The reality is that's the dream. And at a time when it's hard to get resources from electronic health record build situations, we've had to prioritize the changes that we've made locally. We have some very large EMR projects coming down the pipeline over the next 3 to 4 years here. I'm hopeful that perhaps some of that can be built in as we head down these pathways of revamping the EMR here at UPMC. But, if somebody's doing it already and doing it, well, I'm going to be reaching out and asking you for your best practices so that we can learn from those.
Great, thank you. And then another question for Francois. How were you recruited into being involved with the decision-making, the learning health systems for your rehabilitation facility?
So I was generally just very eager to be involved. So it wasn't where there's somebody that chased after me. It was more that something that just happened naturally. Right when I got injured, I wanted to be involved. I wanted to understand more. I was very eager to get as much knowledge as possible. And then that led to me being a peer mentor, then led to me being involved more with my current rehabilitation facility, which then eventually, obviously, because I was surrounded with some of those clinicians and having discussions, then they kind of like when there was new programs, they would if they would thought of me and they thought it would be beneficial to start including me, then they would loop me in and let me know like, are you willing to participate or take part of this? And then over the time, because now it's been 7 years and I've really kept involved with Brooks Rehab throughout that whole process. It's just been I'm always, you know, the one that's like, yeah, let's do something. I try to push some initiatives through Brooks as well and things like that. So it happened a little bit more naturally, but obviously it's like once you, I think, acknowledge those patients that are showing that, it's, you know, harness them. Don't just let them go. Take advantage of them, and that's what Brooks did. I think very well with me. So that's kind of how it went, at least for me.
Great. Yeah, I mean, I think we all, you know, recognize the value of having, you know, patients involved, but you know, I think it is challenging, or people just don't know how to do it or get started. I don't know if Kevin or Hallie, you have anything to add to that. I feel like that is an area where clinicians and clinics can grow a lot in really trying to engage the patients more actively. Any comments from either of you?
I think it's kind of culture. I think it's setting the culture and setting the expectation. And if you work in a larger organization, it's going to be harder to change the culture as one individual person. It's not impossible, and you should always be a champion for it. You know, if I was not in a role that I'm in currently, I would kind of start with my local environment, having conversations with the clinicians that I work with on a day-to-day basis. Any opportunities I have for mentoring, you know, if there's younger clinicians reaching out for assistance with patients, it's a great time to say, hey, you know, I always talk to my patients about their outcomes or, you know, things like that. So I also think if you've had the opportunity to have the experience as a patient, you know, Francois was talking as a patient, but we've all been patients. And I can remember one specific time where a physician said, hey, you know, this is how it is. I could line 10 people up and five physicians would recommend this, 5 would recommend that. This is the strategy if you take, this is what could happen if we take this route. This is what could happen if we take that route. What do you think? And I was like, wow. What do I think? You know, and I gave my feedback and the physician said, yeah, that's what I would do too. But she didn't lead with that. She led with, you know, it's probably a toss up. What do you want to do? So I think having an experience like that as a patient taught me to be a better provider and be more of an advocate for talking with the patients. But I think it's probably cultural. It's certainly probably post-professional and professional education, ingraining that topic of shared decision-making into the provider's culture, probably across all of medicine and rehabilitation. I don't know how to solve that though, but
great.
It's a good dream.
Kevin, do you have anything to add?
No, I know that we try to train our care professionals and those that are engaging with patients on being able to do this. But yeah, nothing significant to add. It's one of those important but not easy to solve.
Right. All right. Well, I think we're right on time to kind of wrap this up. I want to thank our panelists. This was a great discussion. I think it was a nice way to kind of end the forum. I think this is a long journey. I think that was one common theme that we've been hearing throughout. But I also feel like there's been progress and people have had successes and you know, I think, you know, as a profession, we just have to kind of hang in there and keep trying to move forward with this. But it is an extremely slow process to you know, to really get to this this end game where you're really kind of accessing the data and utilizing it to its maximum.